Hello and welcome to the Protect Our Care Illinois webinar. This week's webinar is about the fight is not over, protecting our healthcare now and into the future. Thank you so much for joining us today. Of the panelists, we will have myself. My name is Alaina Kennedy. I'm from the AIDS Foundation of Chicago. We will have Daniel Rabbitt from Heartland Alliance, Graciela Guzman, Patient Innovation Center, Katie Jones from the Peoria Healthcare Coalition. Just a few housekeeping rules and instructions. All attendees are in listen-only mode. We have a lot of you attending today, and it would be too much to have you all have the chat function. But during the time, you can submit questions, and we will submit answers through the podcast, but then we will also be leaving a portion at the end of the podcast for a question and answer segment. If you have, well, never mind. If you have questions, you can submit them on this side. During the question feature, you can input them. We will be collecting those all towards the end. So if I'm not responding during the webinar, keep your ear open for them at the end. You can also join the conversation on Twitter at ProtectILCare. You can use hashtag ProtectOurCare, hashtag SaveACA, and hashtag Medicaid Matters. And then you can download the slides for the webinar at www.protectourcareil.org. Once again, today's agenda, we will be going into it, understanding the efforts to repeal and replace the ACA by yours truly. We will then go into the open enrollment and all of the exciting things that are going on with that, with Graciela. What's next with healthcare with Daniel Rabbitt, and then Peoria Healthcare Coalition updates by Katie Jones. And like I said at the end, we'll still leave room for all of your amazing questions and hopefully some amazing answers. All right, so getting into it, understanding the efforts to repeal and replace the Affordable Health Care. Next slide. Once again, this is hosted by Protect Our Care Coalition. Protect Our Care is a statewide coalition of healthcare advocates, providers, consumers, and workers working to prevent the repeal of the Affordable Care Act, also known as the ACA, prevent disastrous changes to Medicaid, and protect and expand access to quality, affordable health care. We have about 100 statewide organizational members and have reached thousands of Illinoisans in our campaign to protect and to build upon the progress made by the ACA and Medicaid. All right, so going into the next slide. So, pre-ACA. Thankfully, that seems like a long time ago, but it really isn't. Pre-ACA, we had high uninsured rates. For example, the share of the non-elderly population lacked insurance coverage hovered around 16% between 1995 and 2007, then peaked during the ensuing economic recession, as you can see from the chart. As earlier provisions of the ACA went into effect in 2010, and as the economy improved, the uninsured rate began to drop. With the implementation of the major ACA coverage provisions in 2014, the uninsured rate dropped dramatically and continued to fall. We continued to see these coverage gains from 2013 and 2015, where a particularly large amount of groups targeted by the ACA, including adults and poor and low-income individuals. The uninsured rates among non-elderly adults dropped from 20.4% to 12.8% in 2015, representing a 7.6 percentage drop point, or a 37% decline. Coverage gains were seen in new ACA coverage options, and as of March 2016, over 11 million people were enrolled in state or federal marketplace plans. And as of June 2016, Medicaid enrollment has grown by over 15 million, or 27%, since the period before open enrollment. This is huge, and this is substantial. Next slide. So, The Affordable Care Act has accomplished quite a bit. It was signed into law March 23rd, 2010. It has strengthened health insurance coverage, requires everyone to purchase insurance, and increased access, creating both the marketplace and expanding Medicaid. Since the Affordable Care Act was signed into law in 2010, in Illinois, the uninsured rate has fallen by 49%. I cannot stress how amazing that is. The ACA also included many insurance reforms to protect Illinoisans, including prohibiting insurance companies from charging women more than men, delaying insurance to people with pre-existing conditions, etc. Next slide. But even with these amazing gains, Trump continues to sabotage the ACA. The Trump administration and congressional Republicans have created a deliberate campaign to sabotage the ACA, starving it of funding, stroking marketplace uncertainty, throwing up roadblocks to harm patients, and repeated efforts throughout the year to repeal the ACA. These threats have created further instability in the individual market, where approximately 12 million Americans, including 350,000 Illinoisans, or about 3% of the state, purchase their health insurance. Next slide. So what I've got right here is a timeline of events from when Trump came into office. On January 20th, 2017, President Trump's inauguration day, his first act as president was to direct via executive order the Secretary of Health and Human Services, or HHS, and other agencies agency heads to minimize the economic and regulatory burdens of the ACA and waive, defer, and grant exemptions from or delay the implementation of the ACA. This immediate action threw into uncertainty whether the IRS would enforce the individual employer mandate, bring about confusion for consumers and insurers across the board. The lack of clear guidance regarding future enforcement of the individual mandate created great uncertainty, like I had mentioned, and was the first step to sabotaging the ACA. As we will see over the course of the year, there were continual attempts both through executive orders, through rulemaking, through funding, and through Congress. Next slide. This next slide represents closer to where we are. Senate Republicans failed to pass the ACA and replace the ACA subsequently. Next slide. A lot of what they were trying to do was cap or cut Medicaid and Medicaid expansion, cut the financial assistance, and create less comprehensive health plans. Next slide. Ultimately, the impact of all of what they were doing would create fewer insured, less coverage, higher costs. Next slide. But thankfully, to a lot of the work that happened, it didn't get passed. And Donald Trump has said in his very infamous tweets that this will result in Obamacare imploding. Next slide. But repeal is dormant now. It wasn't able to pass. We had the Graham-Cassidy bill, we had the American Health Care Act, and many other types of repeal, delay, repeal without replace. It all went away. They have failed to have a repeal and replace at this time, but just like a bear, it is sleeping and it is not dormant. But I want to pause and say, next slide. Because of the efforts that you all have done, because of the amazing work that all of you have come together, we still have the Affordable Care Act. All of these efforts to sabotage are meant to disorganize us, to disenfranchise, and to create chaos within the marketplace. The ACA, though, is still the law of the land. And like I said, it is because of the efforts and work that you have done as advocates, as providers, and as consumers. Next slide. But as we pause and say that the ACA is the law of the land, we have to say that there are still going to be sabotages, and we still need to be ever vigilant as we continue to move forward. Republicans are taking deliberate action still to sabotage, and as a result, Midwest states like Illinois, Indiana, Michigan, and Ohio attribute rate increases to uncertainty over whether the Trump administration would make cost-sharing reduction payments. Next slide. Over the course of the year, there have been a lot of changes, and what's happening right now, though, is that former HHS Secretary Tom Price started using funds for consumer-informed outreach and created a series of testimonial videos featuring people who have allegedly been, quote-unquote, harmed by the ACA. The first video was published on YouTube on June 7th, 2017. HHS used its Twitter profile, run by then Secretary Tom Price, to amplify these videos and anti-ACA messages. HHS's anti-ACA actions call into question the appropriateness of using these federal funds for partisan purposes rather than informational purposes to educate people about health and human services programs offered by the government. Trump administration also announced that it would reduce funding for marketplace advertisements and outreach, as well as navigator awareness. At the end of August in 2017, the Trump administration announced it would reduce funding for marketplace advertisements and outreach by at least 90% and cut consumer enrollment assistance through the Navigator program by 40%, an overall $115 million cut. In Illinois specifically, Illinois Navigator awardees saw that funding was cut by 31%, which is nearly $800,000. For those of you who may not know, the Navigator program helps facilitate enrollment of people into the individual marketplace by providing information and educational outreach about health insurance programs. Navigators raise awareness about marketplace coverage, provide fair and impartial information about health plan options and subsidies to make coverage more affordable, and make referrals for people to get appropriate assistance if they have coverage issues. Since its inception, the Navigator program has helped educate more than 9 million consumers about their health insurance options. Without these navigators, many people will remain uninsured or pick coverage options they do not suit their price range or healthcare needs. Next slide. What is also happening right now is that CMS announced that consumers would not be able to sign up for health insurance on healthcare.gov for 12 hours almost every Sunday during the 2018 enrollment period, reducing by approximately 3 days the already condensed sign-up window. The website will also be shut down overnight on November 1st, the very first day of enrollment of 2018, reportedly for quote-unquote scheduled maintenance, despite no major technical challenges during the past 2 years' enrollment periods. During these windows, the entire website will be taken offline, and people will not be able to sign up for coverage or access the website for informational purposes. These extensive blackout periods will severely hamper sign-up efforts. Sunday mornings are a popular time for open enrollment outreach through community events and faith-based gatherings. I know personally I've signed up for the marketplace on a Sunday. Without the ability to pursue the website or show consumers how to sign up immediately, enrollment efforts will be severely diminished. Next slide. There was also an executive order that was recently passed. This executive order is a backdoor attempt to sabotage the ACA by creating a loophole for groups and individuals to buy skimpier health plans. The order promises to gut key consumer protections like those for pre-existing conditions and lifetime caps, destabilize the market, and cause premiums to skyrocket, and ultimately reduce access to health care. Though all of us will pay the price, sicker consumers, older adults, and working families will be hit hardest. This executive order lets insurance companies sell junk. Also, the Trump administration has ended cost-sharing reductions for insurance marketplace plans. Insurers in Illinois actually assumed that cost-sharing reductions would be cut in their 2018 proposed marketplace rates, which is why they were increased their silver level premium so much this year. So we don't think anything will change with those. Illinois' largest insurers, Blue Cross Blue Shield of Illinois, said it plans to remain in the exchange next year and already took into account the possible end of subsidies when it filed its rates, as well as the Health Alliance Medical Plans, which offers exchange plans mostly in central and southern Illinois. This is because the Illinois Department of Insurance Director, Jennifer Hammer, said insurers have been advised to apply the cost-sharing reduction uncertainty cost solely to silver plans. She went on to say that DOI is committed to ensuring that consumers are prevented from incurring higher health care costs due to uncertainty in Illinois. Now, I just also want to pause and say that for those of you who are looking to buy on the marketplace and qualify for cost-sharing reductions, next slide, which is about 175,000 people in Illinois, those cost-sharing reductions will still be available to you. By Trump ending those cost-sharing reductions, it's not putting the onus on you, the consumer, it's putting it on the insurance company. Insurance companies are still required by law, because we know the ACA is still the law, to provide those cost-sharing reductions. So in Illinois, more than 350,000 people are enrolled in the health insurance through the exchange. And like I said, about 175 of those consumers benefit from cost-sharing reductions. Specifically for AFC and the people that are our priority populations, this has been transformative for people living with HIV. Nearly 3,000 people with HIV gained coverage through the health insurance marketplace and had premiums and out-of-pocket costs paid for by ADAP, which is the AIDS Drug Assistance Program. Next slide. Also, just in case you are concerned, the ACA's Marketplace is an online shopping tool where individuals may shop for health insurance, compare benefits and prices, access financial assistance, and enroll in plans. Next slide. Now, when you're looking and selecting a plan, remember that your premium is not the only thing you should factor when selecting. It's important to look at your financial help, your doctors, your hospitals, and prescriptions. But I'll pause there and let Gabrielle tell more about that as we move forward. Before I finish up, I just want to say that the Trump administration has said the best thing to do is let Obamacare implode and let it be a disaster because we can blame it on the Democrats. But all of his actions have put this on him. If this healthcare fails, it will be on him. But I want to pause and say once again, the ACA is the law of the land, and it has not failed. And that's because of the work you have continued to do and by being informed and engaging in webinars like this. So thank you again for participating and taking the time to do so. Remember, open enrollment does begin November 1st, and I will now open it up to Gabriela to tell us a little bit more about that. Next slide. And I'm sorry, Graciela, I do apologize.
Of course. Well, thank you so much for that introduction. As mentioned, I'm Graciela Guzman. I'm a navigator with the Patient Innovation Center. I'm also part of the coalition of sisters here in Illinois that you may have heard about called the Illinois Coalition for Health Access. And so I'm hopeful this conversation will be kind of helpful in terms of where we're thinking. So a little bit just briefly about the coalition, because I think it kind of sets it up for some of the solutions and approaches that we are eagerly putting in place on the ground for the November 1 open enrollment date. The Illinois Coalition for Health Access, as I've mentioned, a sister-based agency. We have a data subcommittee that released a compendium of data in terms of where were the biggest targets for re-enrollment across the state. So happy to make sure that that's a resource that comes your way if you haven't seen that yet. The second subcommittee, that we have is our Outreach and Operations Subcommittee, which is full of assisters that are planning events, highlighting opportunities for outreach that are needed. And I'll talk a little bit more about ways that folks can get involved if that's something that they'd like to do on the ground. And then lastly, I'd like to highlight the work of our Advocacy and Messaging Subcommittee, which throughout the summer kind of distilled some of the consumer points to just kind of land in like a pat message that's kind of been tested and vetted, just to make sure that we're being as clear as we can around consumer messaging. Next slide, please. Great. And so that being said, some of the core messages that we heard and are really pushing this year, the first one is, as Alaina already mentioned, the ACA is still here. It's still the law of the land, and more importantly, highlighting that if consumers enroll in a plan in 2018, they will have coverage this year. A lot of people have had concerns, I think with good reason, about whether that would be the case, but we really have to kind of reiterate that message still. The second message being, as mentioned here, 80% of people in Illinois have qualified for some kind of discount or financial assistance on their health insurance, and the best way to figure out if they're a candidate for that is to either get in touch with a navigator, use the local plan search tool. The point is really kind of dig into whether they might be a good candidate for that kind of financial assistance. And then despite some of the budgeting cuts that have happened to navigator groups across the state, there are navigators and certified application counselors that are present throughout the state. I'll talk a little bit more in depth at some point in this presentation about the ways that, one, you can find out what is the local assistance locally with you, and then how you might be able to help them amplify their work on the ground. Next slide, please. And the last 2 points that I just kind of wanted to hit in terms of key messages for the open enrollment is just reiterating this open enrollment deadline. As it's already been mentioned, I don't want to preach to the choir, but it's 6 weeks. It's much shorter than a lot of people have thought in the past. And believe it or not, as a lot of people still have not heard that there's a deadline, they're assuming that they're going to have until January or February, as they've had in previous years. And in this instance, that could cause them to miss it entirely. So I think if we have to think about like the top line core message, the pressure on the open enrollment is probably the biggest one for us by far. And then you've already heard about how the ACA has consumers' backs in regards to covering the difference if you qualify for financial assistance. Next slide, please. Great. So I wanted to discuss just a couple of ways that we're engaging with the community in ways that folks can get involved. One, we have a website in which you can locate at ilcha.org. And on that website, you'll find our story banking tool. Protect Our Care is a great partner in terms of using the story bank. And I really highly encourage anyone who still has stories, consumers, et cetera, that have not used the story bank to really help us by getting the word out there about the bank. Many partners throughout the state use that story banking tool. So I still think that, the impact and personal stories requests that we receive almost daily is really important, and any way that you can help us kind of collect that feedback is really vital. Number two, I would say amplifying this message. You've kind of heard the 5 key messages that we've had about open enrollment. I'll be talking a little bit about social media and some of the work that groups like Indivisible, for example, are doing around thunder clamping. But a lot of people say, oh, I'm too busy, I'm at work, I can't really do this. But I'm willing to bet that most of everyone on this panel or on this phone call has some sort of social media, and that's a really great tool to use. And then lastly, in terms of point number 3, just connecting anyone that's looking for local assistance to use the connector tool, which is available on the ILCHA website, but also available on Get Covered Illinois' website, as well as many other partner agencies throughout the state. Next slide, please. Great. And for those of you that haven't been able to use the connector, you insert your zip code. You're able to change the search engine for miles and the language. You get a list of agencies that pop up. And if they produce a schedule, you can move to schedule online. And as you can see, there's many options. The consumer can choose the time frame. And upon selecting the appointment, They insert some very light demographic information about themselves, their first name, last name, phone number, or email if they'd like some kind of a reminder text or email, and it locks in that appointment with the consumer and with the agency at the time that they've selected. And so I say that because I know that many of our great partners and Indivisible have been working with us to get us just any entries that they see as outdated, entries that are still kind of in progress. We are working almost around the clock to get all of these entries updated, and we should be fully optimized by open enrollment in terms of everything that is front-facing on the connector site. The advantage that we have on the connector, as opposed to other tools like the public search tool on healthcare.gov, is that we administer that locally, so our edits become active in real time. So highly encourage consumers to take a glance at the connector if they're looking for any form of local assistance. It's a great way to get connected to a navigator, do it at ease to them, and more importantly, really convert an outreach touch into a really critical enrollment touch that really could mean the difference whether someone feels supported to complete the enrollment or not. Next slide, please. Great. So I also wanted to talk about 3 other ways that people could get involved. So at this point, that first slide is a little bit outdated, right? But community outreach is still vital throughout the open enrollment period. And so as part of the ILCHA website, if you haven't signed up, there is a volunteer listserv that you can sign up in. On that listserv, you can sign up for things like receiving materials, if you need printed material, pins, posters, that kinds of thing. And so we can commit to getting materials to folks on the ground that would like to, for example, really take ownership of a community area or a community that is in high need. So that's a resource if anyone's interested in hitting the ground hard. The second one is getting out there later. During the course of open enrollment, there will be events that'll be blasted through Get Covered Illinois, through the coalition, and through various partners throughout the state. And so we will be mobilizing volunteers in non-enrollment based functions, things like grading, creating email accounts for consumers who may be enrolling for the first time using healthcare.gov, answering basic questions, screening clients. So if that's an opportunity that folks are interested in, highly encourage that. You may have heard, obviously, with the navigator cuts that a lot of us are thinking smarter about how it is that we can do this work. And so optimizing just all these non-enrollment functions really means that navigators are able to see more people, which I think is ultimately what we all would like. And I'll mention briefly, some folks have mentioned kind of that certified application counselor role for anyone that wishes to be licensed and kind of help out by actually being a certified folk that can complete enrollment. If that's something that folks are interested in, there are a handful of agencies, including the Legal Assistance Foundation of Chicago, for example, that are taking on the umbrella certification role, and happy to get you connected if that's something that you're interested in as well. Next slide, please. Great. So I wanted to talk about a little bit about the engagement tools that we've been seeing out there. So if you are not already a friend or a like to Illinois Indivisible ACA sign up on Facebook and on Twitter, highly, highly, highly recommended. A committed, smart, sharp crew of folks. So my shout out to Indivisible for everything that they're doing to get the word out. The little ACA sign up project decal that you're seeing there is what you should be seeing when you search for the group on Facebook, and a wonderful resource in terms of these thunderclaps that are being produced to really mobilize our social networks to get the word out about the open enrollment period. Also a great resource if you're looking for local marketing, events, just questions and resource sharing about how can I bring this to my community and onto just other spaces that you're in every day. So highly suggest that if you haven't friended them that you do so. Next slide, please. Some other resources that I would like to highlight in terms of engagement. Many of you may have heard about Get America Covered and some of the efforts that they're doing, particularly with city efforts to kind of produce strong messaging and efforts around enrollment. So I really kind of wanted to give a tag there if you haven't seen their toolkit, which just came out last week, full of really, really great information. Young Invincibles and Out to Enroll are also producing toolkits and graphics. So I think staying connected and authentic to what it is that they're releasing. Everyone's hitting the unified messaging hard, which is awesome. Now it's just about getting connected to those engagement tools as you're doing your work, hopefully to promote the ACA on the ground or using social media. And I think, lastly, next slide, please. One other resource that I wanted to highlight for you all, as I've mentioned, the coalition did produce a flyer that really kind of succinctly points the key facts that the consumers need to know and really hits the deadline hard. Those are really kind of important need to kind of do some myth busting and really set the facts straight. So this is a resource that's available in English and in Spanish, can also be loaded from our website. But if folks want to use that on the ground, please feel free to let us know if that's something that you need printed. Other than that, next slide, please. Just highly encourage folks to sign up using the email distribution serve if they would like to receive the volunteer management survey. Again, that will get folks on our list to receive opportunities for sustained outreach opportunities, sign up for materials, get involved with enrollment events, receive any kind of weekly social media blasts from our advocacy and messaging subcommittee. And again, also just a list of distribution in case you're interested in upcoming outreach training and other capacity building. So I think with that being said, I'd love to hand it over. Thank you so much for your time. Oh, and there's my contact information if you'd like to hit us up.
Thank you so much for that presentation. Moving on, we will have Dan Rabbitt, who is the Project Manager of Health Policy at Heartland Alliance. Dan?
Thanks, Alaina, and thank you too, Graciela. I think, you know, in thinking through all that the healthcare policy world has had to like sustain and persevere in the last year, it's amazing that we got this far. And I think the work that Graciela is doing, Graciela and her partners at Illinois Coalition for Health Access, and folks all around the state to get folks enrolled, that is among the most important things we can do, both to help people get the health care that they need, but also to help with our future policy advocacy fights. You know, we have defeated repeal and replace so far, and that's something to be very proud of, but there's a lot on the horizon that we still need to work towards. And so I wanted to talk about some of those today. Next slide, please. So I'm just going to go over a couple different policy issues that are on the horizon. One is around strengthening the individual market with the Alexander Murray bill and some other possible reforms. Talk about the Children's Health Insurance Program, community health centers, and other health extenders that have expired at this point and need to have their funding reauthorized. Talk some about future threats to Medicaid and in the FY18 budget process, and then end with some aspirational thoughts and ideas around where we want to go from here in a world where we're not constantly on defense. So next slide, please. So to start, I wanted to talk about the Alexander Murray bipartisan ACA stabilization bill. And I just think it is remarkable that we're talking about a bipartisan ACA anything. To the best that I know, this is the first time that that has happened since, I don't know, 2009. So it's something to be, you know, to be proud of and to be hopeful about. You know, whether or not this gets over the finish line, I don't know. But just the fact that we're talking about it at all is something worth knowing. Next slide, please. So because it's bipartisan, you know, it is a compromise. Not everything on it or in it is something that Protect Our Care Illinois or Heartland Alliance would support independent, standalone. But still, all told, you know, I think it's a reasonable a reasonable bargain. The good things about it is that it funds the cost sharing reductions that were ended, I think, a week and a half ago now, unilaterally by the Trump administration. It funds those for the remainder of 2017, all of 2018, and all of 2019. That will remove a lot of the uncertainty that have caused premium prices to spike for this open enrollment, and would kind of take that off the table for future concerns for the next year. It also provides money for outreach and marketing that was cut by the Trump administration as well. And while it does make some changes to the waivers that are allowed in the ACA, it retains protections for pre-existing conditions and essential health benefits. What's less great is that it will be really hard to lower premiums for the plan year that's coming up. There's been some talk of rebates or allowing plans to like refile their prices, but that's just really hard with open enrollment starting in less than a week. It also does loosen ACA waiver requirements some. I won't get into the details, but makes it easier to get certain kinds of waivers and allows for an expansion of catastrophic insurance plans, what's known as copper plans, for all ages rather than just those people under 30. Next slide, please. One thing before I leave Alexander Murray, we don't really know what its prognosis is. If it is to pass, it's going to have to be attached to something else. It's not going to move as a standalone bill. But it is possible that it might be included in some of the year-end legislation that's out there, legislation to fund the government or to authorize CHIP, which we're going to talk about in a second. So it's possible that it might pass, despite the fact that the president has been kind of lukewarm to the deal and a lot of conservatives have opposed it in the media. So we'll have to wait and see what happens. But the fact that it's out there at all, I think, is a victory. What's left out of Alexander Murray are other ways to improve the individual market, which is what's up here right now, such as increasing subsidies so that people aren't paying such high deductibles or such high premiums, fixing what's known as the family glitch, which is a glitch in the law of the ACA that tests affordability based on what it costs for an individual rather than what it costs for a family, and other ways to increase participation by insurers. Next slide, please. So that's all going on with ACA stabilization. Two other really important health policy issues right now are extending funding for the Children's Health Insurance Program and community health centers, which is the next slide. Children's Health Insurance Program is critical. Almost 9 million people nationwide and a couple 100,000 children here in Illinois depend on CHIP, and funding expired on September 30th. Illinois is not expected to run out of money until sometime in 2018, but we really want to see this funding get extended sooner rather than later to take out the uncertainty and give peace of mind to the people who depend on this coverage. Next slide. Community health centers have also had their funding expire, and they face a 70% reduction for the grant cycles, some of which begin January 1, 2018. We are hoping that the health center funding, along with CHIP and some other health program extenders, will be included together, either in a supplemental appropriation bill in November that's mainly needed for disaster relief, or in the year-end funding bills to prevent a government shutdown. But we'll have to wait and see what happens there. Next slide. So at the same time with all of this health policy going on, there is also the FY18 budget resolution. And that's a big threat to Medicaid, as well as potentially Medicare and Social Security. And I think one of Protect Our Care Illinois' biggest things is to say, leave Medicaid alone. You can talk about ways to improve the ACA, to improve the individual market, but Medicaid is working great. 650,000 people have coverage here in Illinois thanks to Medicaid expansion and over 3 million total. And the fact that people in Congress have been eager to make problematic changes to Medicaid is something that we think needs to stop. Next slide, please. The next big risk for Medicaid is the FY18 budget. The budget resolution is kind of the first step in that process, and the House is likely to pass the Senate's budget resolution Thursday, tomorrow, I believe. And that's sort of the first step. That budget sets up what most folks in the press are talking about as tax reform, and that is predominantly what they want to use this vehicle for. But they could also cut Medicare or Medicaid or other safety net programs in the legislation that follows the budget resolution, what is known as budget reconciliation instructions. So it's something that we need to stay vigilant about. Next slide, please. And I do just want to mention that we need to stay vigilant. So when you see, this week when there's news about a budget resolution being passed, know that that's just the first step in the process. What we expect to happen after that is to actually see legislative language sometime early in November, maybe next week or maybe a little bit later than that. That's when we'll really know what they're up to. So far, there's just been resolutions and kind of benchmarks and aspirational things, but legislation will really help us know whether they are going to come after Medicaid or other health programs or not. The action will happen in the House Ways and Means Committee, where Illinois Representatives Peter Roscom and Danny Davis sit. So putting pressure on those representatives to make sure that safety net programs and health programs are left out of this, and that any tax reform doesn't balloon the deficit or disproportionately benefit the wealthy. It's something that we're going to need to do. Next slide, please. And so those are a lot of the threats that we're facing right now, but I did want to spend at least like a minute talking about kind of where we go in the future and what ways can we really improve the healthcare system. That's something that Protect Our Care Illinois, looks forward to being able to engage in, and we think that we can do it sooner than later. We've been amazingly successful so far in defeating repeal and replace, and having systems in place to try to make sure open enrollment goes smoothly and make sure the hundreds of thousands of people who depend on that still get their insurance, and to build what I'd like to think of as a movement. So I just want to leave you with just a couple questions and some things to think about where we go from here. I think in general, our goal is universal affordable coverage. But in thinking about that, we want to think about what are our priorities. I have some up there, but is it the universal part? Is it the affordable part? Is it out-of-pocket costs? Is it promoting public insurance instead of private insurance? These are things we need to think about. Next slide, please. And depending on what the answer of that is in terms of our priorities, will kind of tell us what policies we need to pursue. Right now, the political circumstances make a lot of these not likely, but political circumstances may change. And so do we want to do a Medicaid buy-in or a public option? Do we want to work within our current Medicaid system to expand eligibility? Or do we want to look into something like a single payer approach? That's an open question. Protect Our Care Illinois doesn't explicitly endorse any of these, but we do endorse kind of all of them, and that they would all bring down costs and expand coverage. And we're interested in thinking through how we get there. Next slide, please. One note about single payer, though. I know that a lot of activists out there are big supporters of single payer, and I think if done right, single payer could be a really beneficial thing, either at the state level or at the national level. But we do need to think about the details, and some of these have not really been fleshed out yet by leaders in Congress or leaders on the progressive end of things. But these are things that we really do need to think about if we're going to push that. Next slide. And so I know there's been a lot of threats and a lot of attacks. I do just want to end on the fact that, you know, here we are, almost November, and the ACA is standing and Medicaid is untouched. And I think we're headed in the direction of really, you know, enshrining healthcare as a human right here in Illinois and hopefully in the country. With that, I'm going to pass it back to Alaina.
Thank you so much, Dan. I really appreciate your presentation. Here is some more of the contact information that Dan was talking about. We will provide these slides and this information to you afterwards. So if you want to go back and look at this. Next slide. Moving on, we're going to have Katie. Katie Jones works with the Peoria Healthcare Coalition and will be giving us a few updates. Hi, Katie. Katie, you may need to unmute yourself at this time.
Sorry. Thank you.
No worries.
Katie Jones from the Peoria Healthcare Coalition. Next slide, please. So our group has been working to educate our community, and next slide. We started we took a very cheeky approach. By that I mean really felt that we wanted to build a relationship with the team. That was difficult at first. We really found them to be welcoming of our information. Next slide. However, we really had a good time with us. In February, we took Valentine's and got this 89-cent, I think, Valentine garland, and wrote on the back of it all the reasons why say ACA. We had met with our local mayor, and even though we knew he had no jurisdiction over this, we wanted to talk about, engage his opinion why ACA, and he shared that one of his 4 children, her coverage was provided by ACA, and the high ACA. So I was really interested in change the mind of our Illinois state plan. We did strengthen our communication efforts. Next slide. And as many of you have throughout the state, to can you hear me now? Can you hear me now? All right. Am I back on?
Okay, this is Katie. I'm back on. Can you hear me? Not sure if Alaina and the team can hear me right now. This is Katie Jones from the Peoria Healthcare Coalition. Okay, I think I'm going to hand it back to the organizers. We're having some significant audio problems. My apologies. I think we should open it up for questions.
Yes, I'm still nervous that my insurance company won't be providing the cost sharing reductions even if I enroll. Hello?
Hi, Alaina. I believe that you were cut off for half of that question. Were you starting to ask a question to the panel?
Yes, I was. Thank you so much. So we have one question saying that I received cost sharing reductions in the past. I'm nervous, though, if I sign up for this year, that I will not be receiving my cost sharing reductions and I will be unable to afford my plan. Can these be guaranteed?
Sure. I can take that one. Although I suppose Graciela could too. Like you had mentioned, cost sharing reductions are in the law. So plans are required to offer them specifically on silver plans for people who make under 250% of the federal poverty level. And they're still required to offer those plans to the people who qualify. The ending of the cost sharing reductions, what that really does is it cuts off reimbursement to the insurer. And at least in Illinois, insurers were presuming that those were going to end anyways because the administration had been so non-committal about paying them. So that's already been priced into the premium costs of the plans. So if you are eligible for reduced cost sharing, you still are, and the impact of all this uncertainty is already priced into the premiums.
Thank you, Dan.
Graciela, is there anything else you want to add, or? No? Okay.
So we also have another question. The question said, as you all spoke to earlier this month, Trump announced that the administration would stop paying for the cost sharing reductions. I heard there was a lawsuit filed by a few states, including the District of Columbia. Was Illinois one of those states? So to answer that, yes, Illinois was one of those states that filed the lawsuit. It is led by a California attorney. Dan, do you have anything that you'd want to touch base on, where the status of that is, or anything else regarding the matter?
Sure. So the arguments were heard in court earlier this week, and a ruling is expected before the week is out, maybe even today. That's what I've read. And that court case, the 19 states, including Illinois, are asking for an injunction for the judge to compel the federal government to continue to make those payments. That's a pretty tall order, and so I don't know that we can count on success in the case, but we'll have to wait and see what the ruling is when that comes out.
Thank you so much. So I have another question. We've talked extensively about the cost sharing reductions and what that has meant for premium increases. One thing that I had noted was that the Department of Insurance advised insurance companies to increase premiums based on the fact that they might not have cost sharing reductions for their silver plan, which Dan, you also had reiterated. What does that mean for gold and bronze? So Dan, I will take the lead for this one, and then if you want to fill in maybe. So my understanding that it's always important to check your plan details to see if the costs, benefits, or providers have changed and to compare them with other plans. Especially this year, failing to do so can mean you miss out on significant opportunities to get the best bang for your buck. So my understanding is because of the wrinkle in premium pricings this year, some consumers may be able to buy gold plans, one of the most comprehensive offered on the market, for a lower premium than that of the less generous silver plans. For the same reasons, consumers who buy a bronze plan, whose coverage is less generous than a silver plan, may owe no premium at all. Marketplace plans are grouped into 4 levels of coverage: bronze plans, silver, Gold, and Platinum. The health law provides two types of subsidies to help lower income consumers buy coverage on the marketplace. And so it's important to look at maybe the gold and the bronze as well and see what works best for you. Dan, is there anything that you want to fill in with that question?
Nope, that sounds right. I think it's important to check the plans. The prices are different this year because of how insurers priced in the potential loss of the cost sharing reductions. So I would just take an extra close look at, particularly at the gold plans, because your premium subsidy is likely to be higher this year than it has been in the past.
Awesome. Okay, we have one more question as well. So I already have a plan, or say and I'll also use this for a provider, say that your customer already has a plan. What if I don't sign up enrollment? Do I have the same plan for next year? So once more, say someone already has a plan on the marketplace, they don't re-enroll, will they have that same plan next year?
Graciela, do you want to take that one?
I can also take that one. If you don't take the step to renew plans or update your income and other personal information, your insurer or the marketplace might automatically enroll you in another plan, but this coverage might not be sufficient to your needs. Plans change every year. The prices change every year. The coverage changes every year. It is very important that you seek out and look and review the plans. My understanding is based off of a survey by the Kaiser Family Foundation earlier this year. It looks about 2/3 said they would stick with the plan that was available or that they have. But that doesn't automatically mean that your insurer will be covering that exact plan at that price that you had and with the same coverage. Your doctor might not also accept that plan or coverage, and the network that you typically work with might not accept that. So it's really important for you now, with it a week until open enrollment, to really start preparing. What medications do you use? What doctor do you plan on going to, and will they accept that plan? The doctors may not know, so it's also important to work with the administrators in the office. So that's just my quick and dirty answer.
Sure, this is Graciela. Can you all hear me?
Okay. Hi, yes, we can.
Great, perfect. I was just going to mention, along with auto enrollment, I think the key date to remember there, obviously the open enrollment deadline is December 15th. So usually auto enrollment occurs on that day. So if a consumer didn't sign up, they would presumably kind of roll on beginning January 1. The other thing that, I think Alaina's answer was great. The only kind of addition I would make to that is that I know I've heard about consumers telling us that their particular plan, specifically with Blue Cross Blue Shield, for example, and Blue Precision, may not be happening anymore. It's not so much that the entire Blue Precision suite won't be around. It's just that a handful of those that existed last year won't be coming back. So again, that Alaina's message about shopping around for their plans and networks, those key details are important. I also say that knowing that in a lot of instances, hospitals and hospital networks don't usually formalize their networks in a way that makes it easy for consumers, right the first week of November. So I just highly encourage, I think consumers to continue reaching out to their hospital systems with that question. They won't really know that it's a consumer issue if they're not hearing the need for that network information to be present. So I just encourage that, knowing that in the past, we've experienced some hospital systems that were not fully aware of their contracting until mid-November. And in that instance, this could be literally halfway through the open enrollment. So I know that that'll probably be a really deep consumer pressure point, just given the short 6 weeks we'll have together.
Thank you so much for saying that so eloquently. I really appreciate that. Moving along, I just want to say thank you to all of our panelists. I apologize, Katie, for the technical difficulties and those who are interested in her presentation. We will be sending out the slides as well so that you can see her slides and hear the webinar after the fact. Until then, you can visit Protect Our Care Illinois' website and view our amazing resources. You can also take action and share your story. Please visit our website again at protectourcareil.org. And remember, the ACA is still the law of the land, and open enrollment is just 1 week away, starting November 1st and going until December 15th. Thank you so much for participating, and have a wonderful day. Goodbye.